I think during the process of giving and getting informed consent, there's often so much information that's given, and it's often given somewhat quickly. And I often have felt that I wasn't given an opportunity to really say, can you clarify this? Or I don't quite feel comfortable with this. And often felt that I was being rushed through informed consent because it was just sort of a bit of hospital business that needed to be taken care of rather than a critically important part of the patient experience. Dr. Buckmiller um, she really listened to me, and she gave me power as a patient. And I had felt, like most patients do, is I felt very vulnerable, especially after the emergency surgery, especially with surgeons just coming in and fixing things. And she really let me decide and make decisions about whether or not I was going to have the surgery. She didn't force me to go either way. She just presented me with the facts in a very compassionate and understanding way.
My philosophy has always been to try to address those concerns and not wait until the day of surgery when you start going through the 1%, 2%, 3%, because at that point you're just focused on the day and the surgery. So I think it's a combination of articulating what you need to articulate as far as the risks of surgery from a medical legal standpoint, as far as your informed consent. But I think there's also another important component is to try to explore what that means to them and their lifestyle. Her decision to come to surgery, she knew had some risks associated with it. And the timing of the surgery truly didn't matter. This was completely elective. And for us, recognizing that, it allows her to really be in charge of that timing. There's some situations that aren't elective, and we can we can give advice and encourage people, but again, this is a choice that the family's making the majority of time. And I think Catherine waited until a time where she said, I'm actually through with important things at school. I've gotten through my finals. I now have time to dedicate to this process. If it goes just like planned, wonderful, I hit the home run. But if there's any complications, then she also had time to deal with that.